Now, you mentioned during your time in the legislature, you carried several pieces of legislation designed to prevent teen suicide. Is the state legislature, are they doing enough to prevent teen suicide, and could they be doing more? And if so, what?
Well, actually, Idaho does very little um, uh, and that's an issue that we've been working with. And this year I was fortunate enough to get to sit down and spend some time with our governor and talk with him. And he was very concerned about the teen piece. He was concerned about the drug interaction with that, but also in teacher education, making sure that our teachers have the right tools and right training. So I think we're going to see, and this is kind of the same way. I've talked to Superintendent Tom Luna, and he's also very much engaged on this piece, and that's the reason his staff and our drug and safe and drug-free schools coordinator was here to help with this project too, is to reach out. But you're right, we don't have a strong enough mental health and substance abuse system in Idaho. But the governor has put together a transformation, a behavioral health transformation work group, which is comprised of all his agency heads working on that issue right now. And it's my hope that when they talk about mental health and they talk about substance abuse, they'll put that suicide prevention piece in that as one of the core services. Because right now, Idaho does not have it in any one agency's mission. And it truly is, we can't do suicide prevention just at the Capitol. It has to reach out where people live and in the communities. So that's where we're hoping all of this, gets back out to the region. And that's why they've done these 7 regional, bringing people together to talk about it.
Right. Now, some of the more conservative members of the Idaho legislature are basically in favor of in the long term, doing away with social services offered by the state, which would mean an increased, for some of them, they believe it would mean an increased reliance on the family and like religious communities for quote unquote social services. Do you believe that families and church groups and other community groups could play a role like that, or do you think that they are not prepared enough to step up in that way?
Well, if we step back and we look at mental health, mental illness is an illness. I've had cancer. When I had cancer, I went to my cancer doctor for treatment. I went to my church for my faith, and I went to my family for support. We have to have those roles. So we have to address mental health because it truly is a mental illness. Mental illness is the leading cause of disabilities in the United States. So to prevent people from becoming so disabled that they can't work, they can't maintain their life and whatever, we need the healthcare mental health system to work. I don't see that as a family role. I see the family role as support and all the things that help each of us in our individual lives. So again, and then I see faith, that's the role of the church and helping provide a supportive community, helping provide that hope that people need to place in their lives. So I think it's again a partnership that and not all one solution. But it's really critical on with suicide prevention that we have strong families and we have strong communities, because that's a big key place, and the faith community. But will that always solve all the issues? It may not.
Right.
And they may need to reach out to counselors and other support systems to reinforce. One of the things about suicide is, and also mental health, it's not, it's no respecter of any, set of a group of people, or it crosses all lines.
Right. Now, final question, I'll let you go. I appreciate your time with us here today. Of course, every department within state government is facing massive budget cuts, and Idaho's Department of Health and Welfare being one of them. The Medicaid program is tremendously underfunded, according to some people. How do you think that those cuts will affect the state's mental health efforts?
Well, it has pretty much devastated it to the point that right now what we're responding to is crisis rather than prevention, or treatment. And the Director Armstrong had made that comment this year that they have to now look at the crisis. Well, what we have set up a situation is that we force somebody up to the point of crisis with a mental health crisis that makes it more difficult for them to come back to recovery and to regain their lives. So we have already began to see more hospitalizations. With substance abuse, we have seen an increase in prison population since the cuts in drug treatment programs.
Mm-hmm. So
we know, that people are at risk, and the same goes for suicide. 80 to 90% of deaths by suicide have a component of a mental health issue, depression, and/or substance abuse. So we're already seeing that. In 2008, deaths by suicide in Idaho rose 14%. The preliminary data for deaths in Idaho was another 19.5% increase. So those are a lot of deaths that needed a mental health or a substance abuse services could have helped with.
Mm-hmm.
So we're at risk. We are kind of pushed up against but it kind of gets back to, if science tells us that mental illness is an illness, we can see it if we do brain scans, we can see the parts of the brain that aren't functioning quite right,
mm-hmm.
we can see that. But if we treat it as, it's a program that's nice but not necessary, and we can do away with that program if we don't have money. We haven't said that about other healthcare issues. We haven't taken funding away from heart disease or diabetes or
mm-hmm.
something else. So we believe that the cuts are really going to hurt and really make a difference in people's lives. We're already beginning to see that.
Mm-hmm.
And I went through the legislature. I know the difficult time they had, the difficult decisions they had to make, but those decisions really do have consequences, and they have consequences in people's lives.
Right. Alrighty. Thank you for your time.